Welcome back to Healthy Lifestyle with Saira. The topic of our today's video is what is the main difference between angiography and angioplasty and how do they work? An angiography is a minimally invasive procedure that can diagnose the various conditions affecting the arteries and blood vessels, whereas an angioplasty is a procedure that can clear the arteries that may have become narrow due to a buildup of excess plaque. In this video, we will discuss the main difference between an angiography and angioplasty and what to expect from both procedures. I will also explain their types, benefits, risk factors, and potential side effects. What is an angiogram or angiography? An angiogram is a procedure in which a doctor can analyze the blood supply to the heart. It is typically the first line diagnostic test for conditions concerning the blood vessels. The procedure involves injecting a special type of dye known as contrast agent into the blood vessels and taking imaging scans. An angiogram is usually the diagnostic procedure that precedes an angioplasty if a doctor determines an angioplasty to be appropriate. Types of angiography. There are several types of angiogram, including a coronary angiogram, which looks at the heart and surrounding blood vessels, a pulmonary angiogram, which looks at the blood vessels that supply the lungs, a cerebral angiogram, which looks at the blood vessels inside and surrounding the brain, a renal angiogram, which looks at the blood vessels that supply the kidneys. Now I am going to discuss what is an angioplasty and its types. An angioplasty is a non-invasive procedure that can unblock or widen arteries that may have a buildup of excess plaque. It is typically the first line of treatment for various conditions concerning the arteries. An angioplasty usually follows an angiogram if a doctor determines it is necessary. Types of angioplasty. A doctor may use two types of angioplasty to treat conditions concerning the arteries. A percutaneous coronary intervention involves using a small balloon to open or unblock the affected artery. A doctor then places a small mesh metal tube known as a stent into the artery to keep the blood flowing. A balloon angioplasty also involves using a small balloon to open the artery. Many people ask the question, do we need an angiography before angioplasty? Yes, your doctor can prescribe an angiogram to view the arteries of your heart. They use it to gather images that show them where blockages are located in your arteries. If they find blockages, angioplasty is one treatment option. Your angiogram may progress to an angioplasty in the same visit. Uses of an angiogram and angioplasty. A doctor may use an angiogram to investigate several health conditions, such as atherosclerosis. This refers to a buildup of plaque that can lead to chest pain, cramping in the legs, and digestive issues. Angina. Angina is a chest pain due to a restriction of blood flow to the heart. It can cause shortness of breath, fatigue, nausea, and lightheartedness. Next one is blood clots. A blood clot can lead to a stroke or heart attack. Clot symptoms include trouble in breathing, swelling, pain, an irregular heartbeat, and lightheartedness. Peripheral arterial disease. A peripheral arterial disease occurs when a narrowing of the arteries affects the lower limbs. It can cause cramping, weakness, numbness, and a cold feeling in the feet or legs. Coronary artery disease. A coronary artery disease occurs due to a plaque buildup in the arteries that supply blood to the heart. People with this condition may experience chest pain, shortness of breath, and lightheadedness. A doctor may decide to use an angioplasty if a person has peripheral artery disease or coronary artery disease. This is all about the difference between angioplasty and angiography. Hope you enjoyed this video. If you like my video, please subscribe my channel, and for any health related question and query you can ask in the comment section below. Goodbye.